just take for granted because it's a simple assessment that we do. But I also think that people get very busy and they don't take time to think through all the different steps that they need to take. And again, if we, we're really trying to impact the staff's understanding of why that's so important and why we have to take the time to do it correctly.
The topic of discussion for Methodist Physicians Clinics was proper blood pressure monitoring. It's a simple medical procedure, but one that would be vital for hypertension management.
I think we also had feedback from some of our physicians that they were not completely comfortable that their staff was as skilled at taking a blood pressure as they would like.
Each clinic staff received detailed training on the do's and don'ts of effective blood pressure assessment and education on controlling high blood pressure.
So, our message to the staff, and we've really tried to include non-clinical staff as well as clinical staff in this education, because we want all people involved in the care of the patient to understand how important us getting the blood pressure correct is in terms of planning the care for the patient.
Staff and physician buy-in was key to success in the effort to manage hypertension.
When the staff could see that their physicians were really bought into it and were on board, the staff then followed suit, and I think that was really important as well.
We've involved all of our staff. We met separately with our medical assistants and nurses. Primarily with them, we wanted to make sure they understood the importance of what we were doing. We're trying to improve blood pressure control to lower risk for heart disease, stroke, and kidney disease. And also that they are aware of all the importance of taking accurate blood pressure.
Methodist partnered with the Nebraska Health Network's primary care work group to develop a clinical practice guideline and other material to use in everyday practice.
We have badge buddies that can go on their badge, of course, and it goes through those steps so that they don't have to, it reminds them that make sure the patient sits for 5 minutes, that their feet are flat on the floor, that their back is supported, that it just goes through every step so it isn't that page and a half. They can just glance to remind themselves of all the steps.
The results speak for themselves.
When the quality committee decided that that was something we were going to focus on, let's get the doctors involved more, get all of the staff involved, which Lori and I have done with going out and really educating staff. We are now at 75%, so we really made great improvement in that since February of 2016 when we started with the 66%. As of today, every physician is at least at a 4-star HEDIS measure, and as a clinic we're at 5-star.
Depending on how it was presented to the staff, we did walk into a couple meetings where they kind of thought maybe we were coming in to criticize in some way, the processes that they had in place. And I think by the time we left, they all really understood that we just want to help you take the best care of our patients.